I've had a lot of opportunities at Concordia to work interprofessionally. I believe those experiences have been some of my most memorable and the most valuable parts of my time at CUW. I understand that all schools have requirements for their students to participate interprofessionally, but I believe the experiences that were offered to me at CUW went above and beyond the baseline expectations. I was able to learn about the roles of other providers through direct interactions, case studies, and even research projects. The interprofessional experiences offered at CUW helped me increase my awareness of collaboration, communication, diversity, and patient centered care. My interest for the physical therapy profession really started in high school after I hurt my knee, but then my passion and my love for the profession took off. After starting to work in an acute care hospital, they truly valued interprofessional work. I was able to experience how collaboration and communication between providers increase the quality of care and patient outcomes. I was fascinated by the commitment to excellence and the willingness of providers to ask each other for their expertise when needed, which led me to increase my participation and knowledge through the interprofessional activities at Concordia. During my second year at PT school, I was able to participate in a case study through the Wisconsin Area Health Education Center, where students were placed in groups with different health professionals to create a solution to the opioid epidemic in a community. In the case study. So my team consisted of students from studying pharmacy, social work, PA, OTs, and even a dental student. This really helped to reinforce how important diversity teamwork is to creating a solution and creating a good patient-centered care. Although my team did not advance, this experience was essential to me to increase my awareness and appreciation for interprofessionalism. I learned to appreciate the value of diversity within the team, and it gave me a wider perspective of all the different paths that we can take to reach the best solution for our patients. The research course I also chose to take was based on interprofessional care. Several different health professionals came together to investigate how to assess and meet the needs of community dwelling older adults to decrease risk of adverse events such as falls, depression, and readmission to hospitals using an interprofessional model. So before the study, I never considered how important different roles are to things such as decreasing falls. So pharmacists really have to be involved to manage the medications, make sure patients aren't taking a whole bunch of medications that are going to make them dizzy every time they stand up. That social work needs to be involved to make sure the patient has the equipment that's needed for them. So while physical therapists have a huge knowledge in the musculoskeletal needs of patients, they really need to collaborate with other professionals to get the best outcome for patients. So with all the interprofessional events I participated in at CUW, I was able to gain a greater understanding for the role of each professional, which will help me in my role as a future physical therapist.